It was 3:47 in the morning when Robert Holloway walked into the emergency room. He was 72 years old, complaining of abdominal pain and difficulty urinating. His vitals showed elevated blood pressure, 168/95, and a heart rate of 102. But something else caught the medical team's attention. Robert had been to the bathroom 3 times in 15 minutes. Each time, he couldn't urinate, and his wife Linda sat in the corner of the exam room, watching him with an expression that looked like fear. When Dr. Marcus Webb examined Robert's abdomen, he felt a distended bladder, firm and swollen. The digital rectal exam revealed something more concerning. Robert's prostate was rock-hard, asymmetrical, and significantly enlarged. Dr. Webb ordered immediate catheterization and blood work. The catheter drained 1,200 milliliters of dark, blood-tinged urine from Robert's bladder. He had been in urinary retention, his bladder holding more than a liter of urine backing up into his kidneys. Then the blood test results came back. Normal PSA levels range from 0 to 4 nanograms per milliliter. Robert's PSA was 847. The CT scan revealed the full extent of the problem. Robert's prostate was massively enlarged, infiltrating his bladder wall and seminal vesicles. His pelvic lymph nodes were swollen and abnormal. But the cancer hadn't stopped there. The imaging showed multiple sclerotic lesions in his spine, L3, L4, L5, and throughout his thoracic vertebrae. These were bone metastases. The cancer had spread to his skeleton. His kidneys showed bilateral hydronephrosis. Both ureters were obstructed by the tumor, causing his renal function to deteriorate. And in his lungs, small nodules scattered throughout both lobes suggested pulmonary metastases. Robert Holloway had walked into the ER thinking he had a simple urination problem. He had stage 4 metastatic prostate cancer. When Dr. Webb delivered the diagnosis, Linda broke down. "I told him," she said through tears. "For 6 months, I told him to see a doctor." Robert admitted he'd been experiencing symptoms for weeks, possibly months. The difficulty urinating, the blood, the pain. But he convinced himself it was just normal aging. He was too proud to admit something might be wrong, too scared of what doctors might find. And now, it was too late for a cure. Prostate cancer is one of the most common cancers in men. 1 in 8 men will be diagnosed with it in their lifetime. But here's the critical detail. When caught early, when the cancer is still localized to the prostate, the 5-year survival rate is nearly 100%. Treatment options for early-stage disease include surgery, radiation, or active surveillance. Many men live decades after diagnosis. But Robert's cancer was no longer localized. Stage 4 metastatic prostate cancer has a very different prognosis. Even with aggressive treatment, hormone therapy, radiation, chemotherapy, the median survival is 2 to 5 years. Robert started androgen deprivation therapy immediately. This treatment works by blocking testosterone, which prostate cancer cells need to grow. Over the following months, his PSA dropped from 847 to 124. The pain improved. He could sleep through the night. But the cancer was still there, and it would eventually become resistant to treatment. The tragedy wasn't that Robert had cancer. The tragedy was that if he'd sought medical attention even 6 months earlier, the outcome could have been completely different. Early prostate cancer causes no symptoms, no pain, no urinary problems, nothing. That's why screening exists. 3 months after his diagnosis, Robert sent an email to Dr. Webb. In it, he described something unexpected. Since learning about his cancer, Robert had talked to 12 men in his social circle, friend from his golf league, poker group, and neighborhood. Half of them couldn't remember their last prostate exam. 3 of them were having symptoms similar to Robert's and had been ignoring them. Robert told every single one of them his story, what happened when he waited, what he wished he'd done differently. All 12 men made doctor's appointments. One of them, Jerry, Robert's neighbor 2 doors down, came back with an elevated PSA. A biopsy confirmed early-stage prostate cancer. He had surgery scheduled for the following month. His doctor said they'd caught it just in time. Robert wrote, "I can't get my time back, but maybe I can do something with the time I have left." He started a support group for men with prostate cancer. He spoke at community health events. He broke the silence that so many men maintain around their health. The American Cancer Society estimates that about 35,000 men die from prostate cancer every year in the United States. Many of those deaths are preventable, not because the cancer is always curable, but because early detection dramatically improves outcomes. Robert Holloway lived for 15 months after his diagnosis, not the 2 to 5 years the oncologists had hoped for. His cancer became aggressive, resistant to hormone therapy. It compressed his spinal cord, requiring emergency surgery. Eventually, he needed chemotherapy. He died at home, surrounded by family. But his obituary told another story. It mentioned the support group he'd founded, which continued meeting monthly. It described the community events where he'd spoken about men's health. It noted that, in lieu of flowers, donations should be made to the Prostate Cancer Foundation. 2 weeks after Robert's death, his wife Linda spoke at a fundraiser. "My husband died because he was too proud to see a doctor," she said. "He thought being a man meant suffering in silence. That's not strength. That's fear." She continued, "Prostate cancer is the second leading cause of cancer death in men. But it doesn't have to be. Screening saves lives. Early detection saves lives. And talking about it saves lives." 3 years later, Dr. Webb was reviewing patient files when he saw a familiar name. Jerry Whitman. Routine follow-up. PSA undetectable. Cancer-free. Robert Holloway didn't beat prostate cancer, but he changed the conversation around it. His story illustrates a critical public health issue. Men are significantly less likely than women to seek preventive medical care. Cultural expectations around masculinity, the idea that real men don't complain, don't show weakness, don't ask for help, literally cost lives. The medical community recommends that men discuss prostate cancer screening with their doctor starting at age 50, or at age 40 if they have a family history of prostate cancer or are African American, as these groups face higher risk. Screening typically involves a PSA blood test and possibly a digital rectal exam. It's not perfect. PSA levels can be elevated for reasons other than cancer, but it's the best tool we have for early detection. Robert's story demonstrates what happens when we wait too long. But Jerry's story shows what's possible when we act in time. One conversation, one screening, one life saved. Because the weight of silence kills, but the power of truth saves. If you're a man over 50 or over 40 with risk factors, talk to your doctor about prostate cancer screening. Early detection changes everything.
Share this story. It could save a life. Like and subscribe for more.